If somebody is incarcerated and they're getting these injections and the community has decided to pay for them, the community's paying for them. Your taxes are paying for them.
Absolutely.
Once they're out, now they're subject to third-party payers or other Medicaid, Medicare.
Or state funding.
Or state. So do most payers cover this once they're discharged?
The long-lasting
Yeah.
injectable?
Well, that's
a question for the
it's,
doc.
You know, individual states, counties are all different. That's why the long-acting injectable, when they leave, gives you a little bit of leeway because maybe they were on Medicaid or Medicare, and now they have to reestablish that. You need a team to help them because every step, who's going to drive them from the facility to where they're going to be staying? Every little step has to be planned, and that takes, it does take a
And in
village, and it
fact-
takes a while.
And that's why you've seen one county.
Getting back to the previous point, the first and the second generation, actually the second generation have advantages for patients with mood disorders, with bipolar disorders. And actually some of these new medications are not covered by some insurance companies, so it is a problem.
Just another moving part.
And let me add a point that the judge made, the overlap between the homelessness and mental illness. And medicine now needs to be patient-based. That means that you go where the patient is. And many of our individuals with mental illness are homeless. So actually, there's been places like in San Antonio where the physicians actually go to the homeless shelters and they provide
in Miami, we
medications.
go to the street.
And you mentioned that one.
We prescribe
Yes.
and inject on the street.
Really?
Yes, and it's wonderful because a lot
That's
of
where the
people who are
patients are.
homeless with mental illness, they're overstimulated. It's not that they don't want housing, they don't want to be in a loud housing situation. So we'll treat now on the street, watch their symptoms get reduced, and then gently try to reintegrate them back into
All
our
right.
system.